Hi everybody, it's Enrica. Today is January 13th, 2012, and I just got back from my 2-week post-op check-up with my surgeon that did my gastric sleeve procedure. I had the gastric sleeve done on December 27th, so it's approximately about 2.5 weeks since surgery. I heard a lot of good things, and it was really a good visit because it kind of gave me another sense of or another way to measure my success. I've lowered my BMI by 5 points already, and that's since August, and that's really good. I really hadn't even given that any thought as far as BMI. My BMI back in August was 51. The day of surgery, it was 48. And then today, which is 2.5 weeks later, my BMI is 46. So that's 5 points of my BMI down. And that's great. That's wonderful to hear. My weight loss is so far 15 pounds since surgery. I lost 12 pounds the first week, 2 pounds the second week. That was as of Tuesday. So since from Tuesday to Friday, I've lost another pound. Overall, that is, he said, since surgery, the 15 pounds that I've lost is about 9% of my excess body weight. So that was really great to hear, and I love to hear other or think of other ways of measuring my success as far as weight loss, because it's really easy to get caught up in numbers and pounds. How many pounds did I lose overall? How many pounds have I lost this week? It's good to hear that, but it's also good to hear it in terms of health and energy level, and seeing these comorbidities get knocked off of your medical history. It's also good now to think of it in terms of BMI. So it really helps me to stay focused and motivated, because if I just think of like, oh, I just lost a pound this week, or it gets really discouraging very easily. So I have to refocus myself and think about the positives. Some other things that came up during my doctor's visit. I have a vitamin D deficiency. They discovered that while I was in the hospital. I wasn't told of it at the time, but the doctor isn't concerned. It's a very easy case of just adding a vitamin D3 vitamin into my scheduled vitamins. So now I'm taking 5 vitamins a day, and I have my calcium citrate chewables, I have multivitamin chewables, I have my iron chewable, I have my sublingual B12 vitamin, which I found out today. I know you put it under your tongue, and I was doing that, but at the very end, it was like, oh, I just want to get rid of this. So I'd chew up the little disc that was left under my tongue, and I heard today that that's a no-no. The only way it gets absorbed is under your tongue. So it's good to know that. I'm doing good with protein, and I was happy to hear that. I should be taking in from 77 to 92 grams of protein a day. I've been focusing on really getting as much protein as I can with that first morning shake that I do. I do 2 smoothies, one in the morning, one maybe mid-afternoon or after lunch, and I try to get the majority of my protein then. I've been doing peanut butter and banana smoothies. The peanut butter adds protein. The protein powder that I add, plus the fat-free milk that I use, all those things put my protein level at about 36 grams, just for a smoothie, and it's really easy to go down. So with that, doing that twice a day, plus the other things that I've been eating, like the chicken breast and beans and things like that, cottage cheese, I'm anywhere from 92 to 95 grams a day. And yesterday I took in 97 grams of protein. So when I first heard that, I was like, oh, okay, maybe I need to cut back. But the dietitian and the doctor both said it's excellent. The more protein you can get the first 6 weeks, since that's the most critical point, the better for you. So it's not something that I have to cut back. However, I was told, or it was recommended to me, that I cut peanut butter out of my diet, because it's just too many calories for that 1 tablespoon that I'm adding to my shake at a time. Yes, it's good on protein, but the extra 100 calories, got to do away with that. So it was the dietitian told me that with my protein shakes, I should keep in mind to keep it around 300 calories or less if possible. So adding that extra tablespoon of peanut butter, I'm at like 400 calories. And when I think about that, I do 2 of those a day. That's 800 calories right there, and I'm drinking that. And yes, it's a good source of protein, but I got to cut out the peanut butter now. Other things that I heard from the doctor. Luckily, everything's healing good. No, I was kind of afraid that I might be getting some kind of a pulled muscle, or possibly even a hernia in that one incision area that's in the abdominal area where they pull the stomach out of. I've been having a cough on and off, and this was before surgery, but since surgery, it's caused a lot of pain, and it'll happen for a couple of days, and that area will get really sore and tender, and when I move or sneeze, it's really painful, and then it'll go away. And this morning, finally pain soreness went away. This morning I woke up really bad cough, been coughing half today's, like it's around 1 p.m. So all this time since I've been up, I've been coughing pretty badly. It hurts. And so the doctor looked at it. He said, there's no hernia. You don't need to worry about that. At worst, you might be straining the muscle, but there's really nothing that you can do. If it is, causing a little bit of a tear with the stitches, he highly doubts it. And he highly doubts that I'm going to be able to do enough, or I will do enough damage to cause a tear or a hernia. But he says if worst case scenario it happens, it happens. There's not really anything that you can do. It's something that has to be fixed if it happens later on down the line. And I just kind of have to deal with the pain as much as possible. Try to still cough. Try not to avoid things, because that's when pneumonia comes into play still. So I was a little down about that because it is a problem, and it hurts. But there's really nothing that I can do about it. And he said I had to look at the upside. I didn't get no pneumonia, no blood clots, no DVTs, which are the deep vein thrombosis, no infection, no pneumonia. All of these things that I haven't gotten, those are good things. So just focus on that. I can deal with a little the soreness that's caused by my coughing and the strain that it causes. He said within another month I should be healed, and it shouldn't be a problem. So I just kind of have to ride it out for the next month. I was cleared to go back to work. I was cleared to begin exercising again, as long as I'm not doing weightlifting or any heavy stretching. So I'm going to have to put yoga off for a little while, but at least now I can feel okay going to the gym, walking on the treadmill, the elliptical, and things like that. So all good things. I'm happy to hear all that. And I guess I will say goodbye for now, and I hope you all have a great week and are doing great in your weight loss.